Díomh a dhéanamh tá fáilte ar aiscuig Autism Euro Congress, and thank you for joining us for this afternoon's breakout session. My name is Adrian Carroll, and I'm Senior Policy Officer with ASIM. I'm delighted to be chairing this session, which continues the theme of advancing rights from advocacy and activism to policy changes from our earlier session this morning. So this session, we'll hear from a range of speakers who are each kind of tackling barriers to inclusion in different but really important ways. So from using technology to advocate for your rights in healthcare settings, right through to changing public attitudes, to speaking about access to justice within the criminal justice system, but also in terms of kind of influencing wider research around autism itself. So you hear, from today's sessions, you'll hear from researchers who support autistic people to advocate for their rights and to help navigate in complex systems. So here, which highlights the role of public attitudes in shaping autistic people living in society. Studies that examine how the justice systems can better support autistic people, and different reflections around how autism research can become more ethical and neuro-affirming. Taken together, these contributions show how change happens across a range of different levels. So whether it is through using technology to innovate, whether it is in terms of public policy, systemic reform, but also shifts in how knowledge and public perception and attitudes are created and used. So I'd like to kind of give a brief introduction to our range of to our lineup of speakers this afternoon. So our first speaker is Tara O'Donnell Killen from Thriving Autistic CLG, which is Tara will present on the topic of leveraging health tech to revolutionise accessibility, which kind of focuses on the work of using digital tools like digital passports can reduce stress, improve communication, and support autistic people to advocate access healthcare services, and education and employment in their community. We'll also hear from Chloe Keegan from the National Disability Authority in Ireland, who will speak around public attitudes and pathways to enhancing autism inclusion and rights in Ireland, which identifies where public understanding, where areas where different aspects of public attitudes and understanding, where misconceptions persist, and helping to shape, but also in terms of helping to shape national kind of policy and campaigns to support autistic people to be more accepted and included across Irish society. We'll also kind of hear from, our third presentation will come from Dr. Laura Crane of the University of Birmingham, who will share findings from our study on court and tribunal proceedings involving autistic adults in England and Wales. So this research will give vital insights into autistic people's experiences in the justice system, how accommodations can help support autistic people's right to access justice. And finally, we will also hear from Dr. Monique Botha of Durham University, who will speak about kind of like how ableism has helped to shape autism research and policy, and how we can help, and how we can use these findings to build more ethical and inclusive approaches to support around research which better supports or which understands autistic people's needs and better support and works to better support autistic people across many aspects of society. So just to kind of give a little bit of an overview before we begin. So each speaker will speak for 12 minutes, and there will be 3 minutes at the end of each session for presentations. So I think just before we begin, so we will also kind of make sure as well that please just to kind of go through a few housekeeping rules as well, just to make sure that all mobile phones are turned off. And also that you would also kind of hear when there'll also be kind of cue cards as well from each session that figures out that will show you how much time a speaker has for each session. So this yellow card, it shows it's after 10 minutes with 2 minutes. So This will be presented after the speaker has spoken for 10 minutes, so that will tell you that will kind of inform you that there will be 2 minutes left in her speech. And for each subsequent speaker, and for the red card will show when the, I suppose when she will, will give you kind of a sense as well as when they will be about to finish as well. So without further ado, I'd like to hand the floor over to Tara.
Thank you. Thanks so much, Adrian. Good afternoon. My name is Tara O'Donnell-Killen. I'm an autistic psychologist and I'm founder of Thriving Autistic nonprofit and Luminosity Labs. My work spans multiple levels, from supporting people to building a global community of practice that creates opportunities for autistic psychologists, to collaborating with government departments and researchers on systemic change. Today, I'm going to share the development of Advocacy Ally, a neurodiversity affirming technology co-created with our community, and how it can help embed accessibility into the systems that shape our lives. Across Europe, autistic people continue to face systemic barriers in healthcare, education, and work. Despite strong frameworks, the UN Convention on the Rights of Persons with Disabilities, the upcoming EU Disability Strategy, national equality laws, the gap between policy and practice remains wide. Luke Bearden captures this simply. Autism plus environment equals outcome. The difference between thriving and struggling rarely lies inside the person. It lies in how our systems are designed. And as technology increasingly shapes those systems, we face right now a critical question. Will it deepen barriers, or can it be designed to help dismantle them? Back in 2020, when I founded Thriving Autistic, I was working as a psychologist with newly identified autistic adults. Again and again, I saw the same thing. People knew what was difficult for them, but they struggled to put it into the concise, concrete language that systems recognize. But it was more than just that. Many people didn't know what they were entitled to. Most had also internalized their struggles, blaming themselves instead of the environments that excluded them. Thriving Autistic has since grown into a global community of practice. As of today, we've over 1,000 autistic and otherwise neurodivergent practitioners across 19 countries. We're psychologists, therapists, coaches, educators, all working to support our communities. Consistently, the requests came in at our one-to-ones and our group programs. I need help writing this letter. I don't even know how to ask for what I need at work. My therapist doesn't understand how to work with me. Can you help? The advocacy org I went to doesn't know how to help me. What can I do? It became clear that we couldn't meet this demand one by one. So I brought together my two worlds, the community leadership in Thriving Autistic and my technology work at Luminosity Labs. Out of that, Advocacy Ally was born, a neurodiversity affirming technology co-created with and for our community. We tested Advocacy Ally as part of the Discovery Programme. This is a wraparound support initiative for autistic adults funded by Rethink Ireland and Ireland's Department of Children, Equality, Disability, Integration and Youth. Our evaluation was co-led by a neurodivergent team because epistemic justice matters to us. Autistic perspectives shaped every stage of data gathering and interpretation. In our evaluation with 136 participants, 95% reported greater confidence in self-advocacy. The vast majority felt more connected to peers, and many reported improvements in well-being. These are early findings, but they suggest the technology co-created with the community can create tangible results. Advocacy Ally was developed to address a reoccurring challenge in practice. Within a workplace context, for instance, someone may know that working in an open plan office makes them feel unwell and exhausted. But the difficulty can be putting that into clear, rights-based language that institutions recognize. Our tool guides people through structured questions about their lived experience, what happens, when, and how it impacts them. From this, it generates concise language that connects their needs to recognized accommodation frameworks. It doesn't change what people need, it makes those needs legible. In that sense, it's a bridge between lived experience and institutional processes. In our pilot, people used Advocacy Ally alongside our advocacy officers. The next phase for us is testing independent use. And throughout, we've designed it for safety. No data is retained, no identifiers are stored, and it never substitutes for legal or medical advice. The goal is to support, not replace, professional practice. Alongside Advocacy Ally, our health and therapy passports address another persistent barrier: access in healthcare and therapeutic settings. For many autistic people, the challenge is not only the stress of having to repeat their whole story at every appointment with a new person, but also that vital access needs are often overlooked. These passports allow people to set out in advance practical information, such as in healthcare, perhaps no students present in the room if the person prefers a quiet consultation, needing extra time to process information, having information written down rather than being verbally delivered, and sensory differences in the perception and the expression of pain. By presenting these details clearly, the passports can reduce reliance on practitioner training alone, and they can make access possible where it might otherwise fail. They're already being used in practice as fillable PDFs. Our next step is to build on that foundation using the same structured, question-led approach as Advocacy Ally to help people create these passports using technology in ways that reduce overwhelm and reflect their own communication style. I want to be transparent about some of our limitations. Our pilots were primarily in Ireland and the UK, in English, with people who had internet access. Cross-cultural adaptation, translation, and embedding into different systems are challenges still ahead. While early user feedback is strong, we still need longitudinal research. We don't know yet whether these gains in confidence for self-advocacy sustain over time, or whether they translate into tangible changes in employment, in healthcare, or education outcomes. And critically, we don't know, does scaling up these tools create not just individual empowerment, but perhaps also organizational learning? What early feedback suggests is that clearer, more systematic advocacy requests make it easier for organizations to recognize recurring needs. If that holds true at scale, it could open opportunities for systemic adaptation, but that's just a hypothesis that we still need to test. So we don't see these as finished products, but as prototypes, contributions to a wider conversation about how technology can strengthen access and equity alongside efficiency. And when we step back and look at the patterns across these prototypes, we see a broader question emerging. Where does universal design still fall short? And how can tools like these help move it forward? Across practice, we hear the same access needs raised again and again. That repetition is not about individuals. It's evidence that the system must adapt. We've made some progress in the built environment where universal design has become the expectation for new buildings. In digital spaces, the European Digital Accessibility Act has the potential to push accessibility more into the mainstream. But when it comes to how workplaces, healthcare, education, the judicial system, and other public systems interact with neurodivergent people, we're still very far behind. These are precisely the areas where neurodivergent people face some of the steepest barriers. Advocacy Ally sits at this frontier. It's emerged directly out of practice, from years of hearing what people struggle to communicate and co-creating resources inside our community to help meet those needs. The technology supports individuals, yes, but it also equips advocacy organizations, many of which lack training on neurodivergent communication and workplace or healthcare needs. Because this technology is trained on our own resources that we have developed and grounded in legal frameworks, we theorize it will hopefully help reduce bias and stereotypes that can creep in when professionals or advocates don't understand our lived reality. Alongside workplace and education settings, we've already piloted the healthcare passport in settings such as healthcare and justice contexts, supporting autistic people in hospital settings, on jury duty, or as witnesses. Again and again, we see that access officers and advocates often lack the training needed, and this tool could potentially help fill that gap. Our next phase is making Advocacy Ally and our passports multimodal so that people can interact with it in whatever way best fits their processing needs or communication style. Combined with the health and therapy passports, the technology points to something larger, a future where systems can begin embedding common accommodations automatically, whether in workplaces, hospitals, schools, or courts. That's what universal design for neurodivergent people can look like in practice. For too long, autistic people have been expected to adapt to systems that were never designed with us in mind. The next step is clear. Accessibility must be universal, embedded, and co-created. Advocacy Ally and the health and therapy passports are our contribution to this wider effort, practice-based tools that show how universal design principles can be applied to communication and access. And we're now inviting collaborations across Europe with researchers, clinics, and advocacy organizations to test and translate these approaches, always free for disabled people, always grounded in rights and co-created with our community. From my work, I know that change has to happen at multiple levels, supporting people, strengthening communities of practice, and reshaping systems. The tools, we hope, are part of that bigger picture, and I very much look forward to working with those of you who share this vision. Thank you.
Thanks so much, Tara, for your really insightful presentation. We just have a few minutes for we just have time for one or two questions here. So, are there any questions from the floor? Yeah, so just a lady here.
Are you going to be making the toolkit available for members of the autistic community to peer review it further?
Yeah.
So
thank you.
I might take one more question.
Thank you for your question. Yes, absolutely, we are. That's our next phase. Yeah.
Have we any more questions from the floor?
Sorry, could I just expand on that for a second?
Yeah.
Just explain a little. So it was co-created with the autistic community, and so, but at this first phase that we've already completed was where autistic people used it alongside our advocate who is also autistic, because we wanted to make sure that the technology is working and is safe and affirming. And we're almost finished now the process of being able to hand it directly out to our test pool. We've got a number of people who've already signed up, and if you're interested, or anybody here is interested in testing it, you'd be really welcome. That's the very next phase, is getting direct access to autistic people without any advocate in the middle, and see how useful it is then. Thanks.
Thanks so much, Sarah.